With this module, we will instruct you on how to follow a low-sodium diet with flexibility and ease for your client. What is a low-sodium diet? The 2010 Dietary Guidelines for Americans recommend limiting sodium to less than 2,300 milligrams or 1 teaspoon a day. However, a low-sodium diet consists of an intake of less than 2,000 milligrams of sodium a day, which is a little less than a teaspoon. According to Nutritional Foundations and Clinical Applications, a nursing approach, the average American takes in about 6,000 milligrams a day, almost 3 times as much as is recommended. You don't want to completely cut out all sodium because a small amount is essential for regulating the amount of fluid in the body and also helps with functioning of the brain, nervous system, and muscles. Sodium is found in almost every kind of food or beverage. Processed foods are among the highest. A low-sodium diet doesn't mean just removing the salt shaker from the table. Although that is a good start, most sodium comes from processed foods such as canned or frozen foods that aren't labeled as low sodium. The second highest source comes from natural sources such as meat or potatoes. Here are some reasons why your client might need a low-sodium diet. It can help to lower blood pressure, which decreases the risk of heart attack, stroke, and congestive heart failure, and also supports kidney function. Lowering sodium intake can decrease edema or swelling, which is often associated with heart, kidney, and liver disease. Also, clients with diabetes are at a greater risk for high blood pressure, so being on a low-sodium diet can further reduce that risk and the complications previously mentioned. Tracking sodium intake can sometimes be tricky, but here are a few tips to help. The USDA requires food labels for every food product besides fresh fruits and vegetables, and the amount of sodium per serving is labeled on all food products. For a food to be considered low sodium, it must have 140 milligrams or less of sodium per serving. Very low sodium foods contain 35 milligrams or less per serving, and less than 5 milligrams is considered sodium-free. A guideline for picking low sodium options is to choose foods with less than 5% daily value. You should never assume a product is low in sodium. Always check to be certain and be aware of how big the serving size is and how much is actually consumed. Avoid foods that are normally high in sodium, including smoked or cured meats such as canned meat, fish, or poultry, bacon, lunch meat, ham, frankfurters, and sausage, processed foods, canned or prepackaged foods, salted nuts, cheese or cheese spreads, bread or rolls with salted tops, quick breads, biscuits, pancakes or waffle mix, and pickled vegetables, such as olives or pickles. This is not an exclusive list of items high in sodium, but generally these types of foods are high in sodium, so your client should eat them sparingly. One strategy for reducing sodium is to replace salt with other seasonings. Be creative. Try a variety of herbs and spices such as garlic and ginger. Use lemon, vinegar, pepper, or salt-free seasoning blends such as Mrs. Dash. This can help decrease the desire to add salt because of the flavor increase accomplished from these additions. Spices can add a variety of flavors to steamed fresh vegetables or a plain baked potato. Salt substitutes are another good option for those on a low-sodium diet. The flavor is not exactly the same, but it can satisfy that salty craving if needed. If your client has a potassium restriction, be sure to check the label of the salt substitutes because some replace the sodium with potassium. Another good way to decrease sodium is to eat more home-cooked meals made from fresh ingredients. Foods cooked from scratch typically contain less sodium than most instant or boxed meals. When planning and preparing a low-sodium diet, remember the following. Always check and read food labels. Low-sodium labels such as low sodium, unsalted, sodium-free are a good source for lowering intake. Encourage your client to eat more fresh or frozen fruits and vegetables as opposed to those which have been canned or otherwise processed. Also, increase the intake of whole grains. Try to have your clients avoid full salt versions of canned and processed foods. Look for labels that say low sodium and no salt added. Cut back on condiments containing sodium. Try replacing salt with herbs or spices such as pepper, garlic, lemon, parsley, and oregano. For further information, you can utilize websites such as those provided below. You can also request a book on nutritional guidelines from your local library.